We've heard about it throughout the pandemic, hospitals being overrun by patients who have COVID-19. Some have to ration care, forced to decide what patients will receive resources based on who's most likely to survive. The issues become even more challenging in some rural settings where the staff and funds are much lower to begin with. KOIM's Zach Dodge looks at how some rural hospitals are handling the Delta surge and staffing shortages with no real end in sight.
In the center of Nevada, Missouri is a small rural hospital. The people there struggling to stay afloat.
I have been in healthcare for 36 years, and I've really never seen anything like we're experiencing now.
The Delta variant has hit the 71-bed hospital especially hard. COVID patients continue to come in, as well as other emergency patients.
We've had greater challenges as far as available beds statewide, have had to look outside of Missouri occasionally to try to find beds for patients.
As patients await transfers for a higher level of care, emergency room nurse Geneva Blurton explains they have to sit in the ER sometimes for days.
I have been alongside staff who have told me they have called 30 hospitals each day attempting to get a patient moved.
And some 60 miles to the west, St. Luke's Allen County Regional Hospital is trying to navigate a staffing shortage and combat burnout among the staff they do have.
We have established refresh rooms where staff members doing their work hours can come in, sit down, and try to regain and refresh. We try to enlighten the load a little bit on our staff members because it's been tough.
We have been placing our hospital on diversion quite frequently, which would mean please don't bring us any more patients.
Bush explains that's the last thing they want to do, but they don't have the staff to care for more.
As a small hospital, difficult for us to meet the salary demands that are happening in our marketplace. It can be very challenging for us. We do have lots of staff shortages, and some of our administrative staff have returned to the bedside.
So nurses in both cities and across the area are taking it one day at a time, putting out fires as they start.
We have a great team, but limited resources, so trying to figure out how to bring all of our strengths together and make that happen.
We continue to shift and make adjustments so that we can continue to be here. There is concern, though, how much longer we can continue.
In Nevada, Missouri, and Iola, Kansas, Zach Dodge, KOAM News.
We're told the number of COVID patients in both hospitals improved greatly over the weekend. The hospital in Nevada has 3 COVID patients now, and the hospital in Iola has none.